new medicine is changing the lives for people living with a condition that makes it hard to breathe. One local doctor is calling it cutting edge. Kent Lutzen shows us how the drug has improved one man's quality of life.
Breathing. It's not something most of us think twice about. But for Nick Bell and other patients living with cystic fibrosis, it's a constant struggle.
Just a drain on your energy daily. You do so many treatments just to keep yourself breathing.
According to the University of Nebraska Medicine Center, cystic fibrosis is a life-threatening disease that builds up mucus in the lungs with an average survival age of just 47 years. Like most patients, Nick was diagnosed as a baby.
I like to joke around and pretend that my lungs are like these two busted first vehicles I had. I used to have a 1980 Volkswagen Rabbit convertible, and that's my right lung. And I had this old Toyota pickup 4x4, and that's my left lung. And I'm like, I want to die with these suckers.
At low points in his battle with CF, Nick adds it's felt like he was breathing through a straw. However, right now, things have changed. A new drug, Trikafta, was approved by the Food and Drug Administration in October and has dramatically increased Nick's lung function to the point where he's even started working out again. UNMC Dr. Peter Murphy says the medicine is the cutting edge of science.
An average of 14% improvement in lung function, as much as 30% for some folks. They're able to exercise, move about with much less coughing, easier to clear mucus from their lungs.
Unlike other drugs, Trikafta is eligible for 90% of CF patients. For Nick, this new drug has changed his life. About a year ago, Nick's team at UNMC told him to start thinking about fundraising for a lung transplant. However, with this new medicine, that's not even an option. He is no longer eligible for that lung transplant because of the improvements he's seen from this medicine.
To be told that earlier this year, it's how I feel right now, standing in front of cameras, talking about my life. It's a whirlwind. It's definitely been a game changer.
Before Trikafta, Nick's lungs were just functioning at 35%. Now he's at 54%, with a goal of strengthening that number with this new lease on life. In Omaha, Kent Lutzen, 3 News Now.
And without his insurance, Nick says the drug would cost more than $300,000 a year. Although his health has improved, he does fear that insurance companies could limit access to the medicine.